The hip hinge is one of the most important exercises that everybody should be doing. Whether you're a youth, whether you're an adult, whether you're a senior, especially if you're a senior. Now, to understand how the hip hinge works, you gotta go through a hip hinge clinic. I'll take you through the basic movements. So one, start from the floor, get used to the feeling of what it's like to thrust your pelvis forward and drop. The hip hinge comes from the hips. The power comes from the glutes. This position is the easiest way to start. That's your first position. Second position, you're gonna turn over on your knees. You can grab a dowel if you like, and you can have your feet flat. From this position, you're gonna drop your pelvis back and hold. My spine is nice and neutral. From here, I'm gonna thrust up forward, because the majority of people, as they come forward, they're using their back to pull versus their hips. Now, once you have this motion down packed, the next step would be to take a step forward and then thrust your pelvis forward. You come back down, you take a step forward, thrust, okay? Now, if you feel that you've managed to do those exercises and you got the movement, your last step is to grab a dowel. Put the dowel right between your low back, put the top part at the top of your head, and hold on to it from here. Now, what you're doing with the dowel is you're forcing your body to be aligned. As you lower yourself down for the hinge, you're bending the knees slightly, not fully, slightly bending your knees, and you're pushing your pelvis back. As you come forward, you should feel the stretch in your hamstrings and your glutes. The dowel is gonna force you to be in position. From here, you're gonna raise back up and hold. At the top, you're clenching your glutes forward. So here's one more rep, performed with the dowel. And then once you feel you have the movement down packed, you're holding onto a barbell or a dumbbell, you keep as close to your body and you're hinging back. You'll notice that my pelvis goes back and my pelvis comes forward. That is a proper hip hinge. This is an improper hip hinge. My back is bending forward or I'm raising with my head. Always remember, knees bent, pelvis out as far as possible. Pause, smile to camera, and then clench forward.